Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Diagnosis of egg allergy and hypersensitivity. When we talk of allergy, we are talking of allergic reactions that the body mechanism, defense mechanism, produce certain immunoglobulins, the immunoglobulin that reacts with the protein, the allergen that really causes it. So it's safe to say that protein generally, when you talk about protein generally, some proteins do cause the body to react. Those who are sensitive to it are now producing that allergy reaction, and that allergic reaction could be life-threatening for especially when it's anaphylactic, and it could be anaphylactic shock. But some of the sensitivity that we see is just skin reaction, and these are very common with children. Majority of children react to proteins like the milk, egg, peanuts, and co. There are several lists of it, which I shall expose in this slide section. But what we are talking about now is about the egg allergy, where the body reacts to where the egg we take. Egg could be taken raw or fried or even boiled. The cooked egg is less problematic as regards when we talk about children. The children react, some children react to this egg protein, some part of the egg protein. You find it in the albumin, and the egg yolk too has its own protein as well. So the specific protein that the body is reacting to is what the laboratory will always confirm, and that is a special diagnostic test, which is part of the topic that I have listed today. The role of the medical laboratory scientist, therefore, is defined in getting what the baby or the child is reacting to. Adults too do react to this, and it comes out probably milder. But most children, as they grow older in age, they start tolerating this egg or this protein, and you now find that they don't react to it anymore. But we need to understand that if there is any reaction from these children, it is very good for us to really know the kind of symptoms they present with. It could be diarrhea, it could be abdominal discomfort, it could even be nausea. Just mention those reactions that happen, but you try to notice whether it is common with after eating or what have you, so that you can identify that this could be the cause of that reaction. It could even be asthma that these children will present with. These are reactions against the allergic reaction against for example, egg, that is my focus today. So let's move on into the slide session to know more. The outline: objective, introduction, prevention, laboratory diagnosis, and treatment. The objective: to create more awareness of egg allergy that could also be life-threatening, the laboratory diagnosis, prevention, and control, or possibly treatment. The introduction: the food we eat contains some protein allergens that triggers allergic reactions in children and adults. An allergy is a symptomatic overreaction by the immune system to harmless environmental substances such as protein from cow milk, fish, egg, and nut, as well as some pollens, pet dangles, and house dust mites. These substances are referred to as allergens, which are a type of antigen that prompts an intricate immune response upon contact with the immune system of the predisposed susceptible individual. does not happen to everybody. It's only some people. An IgE, immunoglobulin E associated allergy, is characterized as a type 1 hypersensitivity reaction because it is immediate inflammatory immune response that occurs upon contact with an allergen. The type 1 hypersensitivities include life-threatening anaphylaxis, asthma, eczema, drug, insect, and food allergies, which affect nearly 30% of the population worldwide. Prevention. The prevention could also mean preventing the symptoms that we see, like taking vitamins to stop it. Some steps to take to prevent allergic reaction and to lessen their severity if they do happen is: 1. If a person is allergic to egg, analyze food labels very well before you really eat it. Trace amount of egg in food can cause reaction in certain people. When dining out, exercise caution. Don't just eat whatever. Make sure that you eat only those food you are sure does not contain egg. Put on an allergic necklace or bracelet. This may be crucial if you or your child experiences a severe response and is unable to communicate the situation to carriers or others. Inform the people who will be caring for your child about their egg allergy to prevent them from accidentally giving your kids goods containing eggs. Let your child, babysitter, teachers, relatives, or other carriers know about their allergy to eggs. It's very necessary because these reactions could be life-threatening, and one could just lose their child. Make sure children understand what to do in an emergency. Eggs should be avoided if you are nursing. Your child may react to protein found in your milk if he or she has an allergy to eggs. The laboratory diagnosis. Blood and skin tests are usually done. Specific IgE blood test measures the amount of egg-specific IgE antibody in the bloodstream. Higher numerical values indicate a greater probability of an active allergic reaction, though numbers reflect sensitization rather than exact symptom severity. Component resolved diagnosis CRD measures IgE antibodies directed at specific individual egg protein. As shown in the diagram, you can have ovomucoid around the albumin region. Each stable protein high level suggests a strong allergy to both raw and thoroughly baked or cooked egg. The ovalbumin heat sensitive type reactivity here, often seeming baked or heavily heated eggs might still be tolerated. So that tells you that cooked egg will be very acceptable. The skin prick test is another one where you look for the reaction, immediate reaction, when these egg extracts are injected more or less to the skin. Then there is the oral food challenge, also done. Is the considered gold standard diagnostic approach where tiny incremental doses of egg are ingested under strict medical supervision in a clinical setting to confirm or rule out an allergy to egg. Finally, treatment. The best vitamin to tackle allergic symptoms, when you're talking of the symptoms, are vitamin C. It is an antioxidant, and it will surely help prevent things like when you sneeze or have those reactions that are allergic. Vitamin D, even for catarrh and other skin reaction, and zinc. The primary treatment for egg allergies is the strict avoidance of egg and egg-containing products, just like we talk about prevention. This means being vigilant about reading food labels and asking about ingredients when dining out. Antihistamine is a drug that is usually used, and you have the brand name like Benadryl, can help relieve mild allergic symptoms like hives, itching, and sneezing. Epinephrine auto-injector is very good for severe allergic reaction, including anaphylaxis when it's life-threatening, and is a first-line treatment. People with egg allergy, especially those who have had severe reaction in the past, should carry an epinephrine, like you ask the asthmatic patient too as well, at all times. It can be administered in case of a severe reaction and help reverse life-threatening symptoms like difficulty breathing and a drop in blood pressure. Emergency medical care. After using an epinephrine auto-injector, it is essential to seek immediate medical attention at the hospital emergency room, as a single dose of epinephrine may not be sufficient, and further treatment and monitoring are necessary. So that is in a nutshell is how you can help people. That is even your ward, if it's your kid or even yourself, in managing this egg allergic reaction. The laboratory is also very useful to help you identify that the allergen, so that you can avoid it. It's not that you just be reacting and you don't know what you are reacting against, but with the laboratory assistance, it will really find out what you are reacting to. So check more of my videos on this channel, very educative, especially involving laboratory diagnosis.